And the next session before lunch break today, as Khun Chatree already mentioned, is the prospects for healthcare in CLMV countries, presented by Dr. Chatree Duangnet, Chief Operating Officer, Medical Affairs, and Vice President from Bangkok Dusit Medical Services Public Company Limited, or so-called BGH. Thank you very much. And for the Q&A session, we will run again by Khun Chatree Phrawphraikul, the outstanding analyst from Phatra Securities Public Company Limited. So please welcome the distinguished speakers and also the moderator on the stage once again. Please give a round of applause for the speakers. Thank you.
Okay, welcome everyone back to our panel discussion on the prospect for healthcare in LVMC. Thai healthcare is one of the fastest growing sectors in recent years, and as the largest operator in the country, as well as one of the largest in the region, Bangkok Dusit Medical Services is at the forefront of tapping into the growth potential of fast developing LVMC countries. I would like to now turn the floor to Ajahn Chatree, who would begin by sharing with us his view and insight into the challenges and opportunities within the healthcare sector and the prospects of the fast developing LVMC block.
Thank you very much. Good morning, everybody. It's my honor to be sitting here in front of all the lions in the lion den. And number two is obviously the name Chatree is very good, right?
Yes, I agree.
But he's much more better looking than me, so I'm going to start right here, okay? I'm going to talk, I have to walk, otherwise it's going to be sleepy. Let me walk a little bit and talk. I'm going to talk about prospect of healthcare in LVMC, which all of you know that means Upper ASEAN, which strategically our company is very interested in, and we say in many places that we are very interested in this part of the world, our company. And I'm going to make a reverse comment. I'm going to talk about LVMC, and then I'm going to talk a little bit about AEC, and then ASEAN at the end, and then after that going to be a question and answer session. Don't worry, going to be very brief, okay, on this part. I just want to take some of the statistics out of the way so all of you can see the statistics first. And then the most important part that I'm going to talk with you from my heart, according to what the law allows me to talk. Frankly, what's going on, mostly, hopefully, going to be generic. But if things are going to focus on certain organization, I'm going to be only talking to Bangkok Dusit or BGH. I'm not going to make any comment on any other healthcare providers at all. Okay, so that's going to be our guideline today. Okay, so LVMC are for countries in here, and Thailand is number 5 in the top 5, which we call the mainland countries of ASEAN. The mainland BGH is very interested in the countries on the mainland. We're not including us, then going to be LVMC. You can see here Laos population is the least. And then Vietnam has the biggest population, and then Myanmar, and then Cambodia here. If you look at this, GDP per capita, this is purchasing power parity here. You can see that because Laos has the least population, looks like they have pretty good GDP per capita. Okay, looks like that. And when you go to the country, then you have to decide by yourself exactly how rich the people in those countries are. Briefly, key indicators on LVMC, it shows that all those countries still lack of sufficient health care because of life expectancy. When compared to the whole world, the LVMC kind of pretty much lower than average, and obviously lower than the Western countries. Except Vietnam seems to be doing a little bit better job. Under 5 mortality rate, again, looks like the champion is Myanmar here, and Vietnam doing a pretty good job also. Thailand is right here. Thailand is right here. Maternity mortality ratio, meaning death rate of mother after giving birth to a child. That's one of the real big indicators for health care in each country. It seems like Laos has been like this for a long time. Personally, my great-grandma, she married to she was a Laotian, and she married to a French official. And I still remember my great-grandma gave birth to my grandma in Suong Phabang, and she died right after birth. And right now, the rate is still right there. So Laos is very concerned. They are very much, when we go over there, they ask us, could we do something or seriously do something to help improve this for their population. Tuberculosis. Looks like Cambodia is the highest one. And we don't want to lose our status. So HIV, we are the champion. So Thailand is still having problems, especially for new generation. We did pretty good. Thailand did a pretty good job in controlling HIV in my generation. And the younger generation, when they were doing campaign, those new generation, the new waves, they were little babies, and they were not. And then we kind of lack doing any more campaign. After that, we thought we were doing a good job already, so obviously we are not doing a good job. And this is what concern in Thailand. However, this is what concern LVMC, okay? We're going to go back there. Malaria. So champion here is Myanmar. You can see that Vietnam don't have much malaria because they're much they don't have much jungles in their country, not like the rest of us, okay? Then with the standard of living in LVMC, we have growing urban population, and all countries having growing urban populations. And when it comes to growing GDP per capita, again based on PPP per capita in 1,000, all countries are improving. Demand side, expenditure for LVMC are relatively low. That doesn't mean they're bad, because they really need to have those care. The reason it's so low because they don't have much place to go to. They don't have much enough resource or personnel that can take care of them. When compared to demand, compared to OECD countries, it have a big gap. And when you look over here, our countries we're way behind on using healthcare. That means we have to have much opportunity. If we are growing, keep developing, then we're going to catch up with the countries up there. So opportunity is huge. When it comes to government participation in the healthcare they need, you can see that most of the countries, the government doesn't do much at all, except Thailand. Thailand, because of, I think we should be proud, because Thailand, whatever you talk about, the 30 baht or $1 per one visit, but it helps. At least people can declare that they're not going to be left dying in the street. When you don't have any coverage at all, then all of you go to that universal coverage, which I still think is good. We have huge problem financing it, but the concept is good for Thai people. I'm a Thai person. I'm glad that when time comes and I need care that I don't need any coverage. This will be my alternative. So Thailand, you see, is comparison to Europe. It's another. I think it's another slide there. However, I'm sorry, in Europe here. But the rest, government don't do much at all, the blue portion here. On the supply side, physicians, you can see that all LVMC population, a number of physicians per 10,000 population, and a number of beds per 10,000 population, nursing per 10,000 population, hospital per 10,000 populations look like this. But overall, even though the number of physicians, nursing in Thailand, it looks like it's smaller. However, out of all this, Thailand healthcare personnel seem to be very skilled in tertiary care, in more complicated healthcare. And the rest of here, even though sometimes they have more numbers of doctors and nurses, the skill is much less than healthcare personnel in Thailand because of the king's father. He was the Harvard graduated MD and doctors, and he started developing Thailand healthcare system for more than 60 years ago. So by this time, we are much comparable to Western country. So that's why that's the reason why population in LVs in this area still coming to Thailand for help when they are getting to some more complicated illnesses. They're all coming to Thailand because of that exact reason. And provided this is a little bit confusing, Laos seems to have a lot of hospitals. But when you go over there, we just found out we apply for a clinic. We want to have a tele clinic in Luang Prabang. And the law said if you private cannot do a clinic. On whatever we define to be our clinic, they have to call home mall, has to be a hospital. Otherwise, you're not allowed to do all of those. So lots of hospitals in Laos right now, even though they have lots of them, they actually, their ability is mostly more like polyclinics. I say this in very humble way. I'm not offending any country at all, okay? Just what I see personally. Myanmar, right now, start to have some Parkway Pantai try to come in. I don't know how, because we have been preparing for 4 years, still couldn't get a piece of land yet because of even though the main law policy the government allow, but the supporting laws and regulations still not complete yet. Okay? So they have this in Myanmar right now. But we do, not hospital, we do have ancillary services like labs and medical supply. We do have our company in that also. We don't put it in here. Actually, we have in all 3 countries without Vietnam. We have our own company in there also. I'm talking about BGH, okay? Laos, as Chinese, get a lot of influence from China. There are some in Luang Prabang, real big Chinese private hospital in there. Vietnam, we have Chandler and Huan Mai. And then Cambodia, BDMS has been there for almost 6 years now. For 2 smaller hospitals. Right now we're building a huge, a big tertiary referral hospital, which will start in around March of next year. That's the 3rd hospital. So with all LVMC, I'm going to go to AEC a little bit. Regulations in AEC, all of you know already that AEC will help improving the flow. AEC will have positive effect in investment in those countries because they can have free flow of goods, they can have free flow of services, Almost free flow of investment, but they kind of make it easier. Free flow of capitals. And number 5, which is the most important, is free flow of healthcare personnel, like doctors, nurses, and dentists. And I think that's the part that I think is more important than anything else. And that's the part that we worry the most. Because comparing to LVMC, Thailand has, like I said already, a lot higher skilled healthcare personnel. If they're sucked out of our country, we're in big trouble somehow. But that's only one concern that our company's been looking for, and we're working very hard to do engagement for all healthcare personnel, being doctors, nurses, pharmacists, technicians, and other employees. We make sure the engagement is very, very good. Otherwise, they're going to be drained out into those countries when AAC open up by the end of 2015. Low barrier. Because of AAC, the barrier of regional market expansion can be lower. You're talking about commitment to all service, because those countries that has so-and-so is still developing the system of healthcare, they will try to open up to get more know-how into their countries. So all service can be flow into those countries easier. Commitment for private hospital, they're going to want more private hospital to open up, and then especially the one that work with the hospital that have know-how in doing hospital internationally, and commitment to medical services and nursing services. You're talking about, I'm not going to go into detail, in Laos, Vietnam, and Myanmar and Cambodia also. And in ASEAN, ASEAN Hospital Index outperformed the rest of the world. I think that's true. We can see this here. This is Thailand listed. I think it doesn't show much. It's very busy anyway. Forecast point for our continuous growth for the region. For median sales, CAGR year 12 and to year 14 forecasted. We forecast around 12.5% growth for sales and 15.4% growth in EBITDA. So opportunities there in ASEAN countries. And this is just a slide that don't get me wrong, I don't want to brag about Bangkok Hospital, but I want the hospital, the healthcare that can go into those countries should be the hospital that has human resource, financial resources, and know-how resources to go in there. So only hospital that think they are contender to go into those countries that we're looking right now is, this is ourselves, 30 hospital, but we're looking into this. KPJ from Malaysia, they have 22 hospitals, and in fact, they're coming to Thailand right now also trying to. And then Singapore, Malaysia, that's integrated healthcare holdings that actually they're in regional, however, they have a part in India and a part in Turkey also. So they are bigger than BGH. However, they can go anywhere because they have more resources. The rest of them, I'm not sure. Okay, so you have the contender to go into LVMC. You can almost predict who's going to go in there by just look at this. Again, I repeat, I believe, maybe I'm wrong, the company that has more resources, the company that has more doctors, a lot more nurses and resources can go to the other country. And that company, that before they go to another country, they have to transform themselves to be a good international hospital already. After they transform, then they can go and transform somebody and start and transform somebody else. The most critical point of one hospital to go work in LVMC, there must be the the company that has their own unique, that the local people, local expats, and local whoever that want to come to that service should compete with the original hospital. It should be the same, just same identity. So they don't have to fly all the way back here. So that's going to be things that we can see that not so many countries that can go into those countries. And elderlies are getting older. Those have 60 and over, getting more and more in ASEAN here. And they start to spend more also by disposable income per capita in ASEAN continues to grow. And healthcare, total healthcare rising fast. And this is mostly concern Thailand, so I don't think I should show that one. Medical tourist destination, I think we can discuss that later. I think that's pretty much information I'd like to share with you before I go into question and answer session. Do you have any question at this point so far? Before I go to Kun better looking Chatree and have him control me.
If anyone have any questions, please raise your hand. Our staff can bring over a microphone to you, and we can just start off that way as well. If not, then I can start off with a few questions first, then we can open up the floor.
Feel free to raise your hand if you have any questions at all. We'll just come to you with this microphone. Yep, you've got one. Here you go.
Oh, I have one. Look, you skipped the last slide, which I really wanted to see that one. Medical tourism was a $39 billion industry in Thailand last year. How important is that for you and your business model?
For BGH, our income from medical tourism, from international patients, I would say, not counting expats, is around 35%. After we add Phraphraikul, and it was 35%. After we add Phraphraikul and Paulo, they're more concentrated Thai people. We come down to around 25%. So without them, we cannot exist.
Okay, then I'll maybe just start off with a few questions first before we turn the floor back to the audience in the later part of the session. Ajahn Chatree, there's been a lot of excitement around the potential opportunities in the LVMC block. Could you please share with us your view on the region's potential for healthcare businesses such as BGH?
Yes, after all those reasons, we feel potential for LVCM is the highest on our priority right now, because our company would look into those first. It has been stated by our company, by my boss, the president, many times, that we're going to go to upper AEC first, and those are just fit right in. We feel that because of number one, location, they were close, so supporting, you do anything at all, like you go to war, you have to have any troop with better support will win the war. So we don't want to go very far. We want to go to LVMC are the countries that are next door to us, and we can support them much better this way. That's number one. Number two, our know-how is higher, so they're going to be relying on us very much. And right now, they're doing that already. They come to us a lot. And so any country that has to send, any government that see that their citizen has to go out of the country all the time and using a lot of resources of the country, they will want to slow that down, stop that. So they're going to have their own hospital that can at least can do international standard of care. And they're going to have to develop that regardless of what happened. So we want to join them with that part. So later in the future, our vision is going to be that our headquarters here are going to be super tertiary or quaternary, higher than super tertiary, to take care of all the our network hospital in LVMC. And then we do have our own super quaternary. Right now we are working with many top institutions. We intentionally selected institutions in the U.S., healthcare institutions in the U.S., to help support us, to make sure we, all the time, we will have that line of know-how to take care of our hospital in LVMC.
Okay, thank you very much. Another question is, given the huge growth potential, a lot of other private hospital operators, both from Thailand as well as other countries, must also be eyeing opportunities in LVMC closely. What is the current competitiveness situation for private healthcare businesses in these countries? In other words, how competitive is it for the region or for hospitals trying to go into LVMC at the moment?
Yeah, I think it's extremely high. And at the same time, we are looking into this. I think the rest of our able competitors, like I mentioned to you, a few companies, they've known that for a long time too, so they're going to go in there also. Mm-hmm. We feel it's very highly competitive. Only luckily we are closer to this group. You can see why we don't want to go down to Indonesia. We don't want to go down to countries way down there, Malaysia, something like that, because we think we're closer to the upper ones. And culturally, we are closer to them also.
Mm-hmm. So would you say that the cultural resemblance or closeness of Thailand and LVMC would be the main competitive advantage that BGH would have over potential competitors from other ASEAN countries?
Yes, and we are their long-term referral. At least in the last 8 years, they've been coming to us all along, and I don't think all they need to do right now is that I'm sick and tired coming here. Why don't you come next to my home? And lots of people say, well, you do that, you kind of shooting on your own toes. Our company don't believe that. When number one, they're gonna start up their system regardless. Why don't we help them, join them in starting all those? And then, yes, you can have less complicated patient coming to you, but you can have less complicated patient coming to this hospital, the one that used to come to us and used to go everywhere else too. And then only from that, the more complicated case will come to us, and we can work like up to our ability. So I think overall it's going to be more plus than minus.
Okay, thank you very much for that. In addition to the benefits of AEC or ASEAN Economic Community that you mentioned earlier, on the flip side, do you also foresee any risks or challenges as a result of the integration?
AEC, only one that I would worry about is free flow of healthcare personnel. The rest of them, I don't think we worry much, because somebody gonna come to our country, let them come, but we worry more about people, some of those countries. Some countries now having salary 3 times more than our salary. And I think that could be a strong point of reason for our employee to go out to those countries. But they're not from, but those companies that come to LVMC, can you do the same thing also? So I think that's only one challenge. We have to do the best to engage those people, their mouth, their body, and their heart to our company. We've been doing that for more than 3 years now. I think we up to the point that we feel much comfortable right now.
Okay. In terms of the expansion plan into LVMC, I understand that BGH already has a hospital in Cambodia.
Your handphone is ringing.
You can have my handphone. Thank you. Okay. Sorry.
No problem. In terms of the time frame for the expansion into LVMC, I understand that VGH right now has 2 hospitals in Cambodia. In addition to the 2 hospitals in Cambodia, can you maybe talk about the timeline of the expansion and the time frame of when do you think each of these LVMC countries would be ready for a private hospital?
I know my boss can predict how many hospitals we can have in our country because we have full control on environment. But for LVMC, we cannot control the laws, the environment. I don't think I can, honestly, I cannot say much time frame. All we know is that our tertiary care Cambodian Royal Phnom Penh Hospital is going to open this coming March, for sure. And we are starting some project in Luang Prabang, which we're still negotiating with local authorities and national authorities. And we have absolutely no control over what's going to happen. And yes, we have been preparing to go into Myanmar for 4 years. And now we're going negotiating the peace plan. And we have no full control with that. So timing, I'm really sorry, I cannot answer that one.
No problem. Okay, at this time, I would like to also open the floor and give the rest of the audience opportunity to ask questions. So please feel free to raise your hand, and our staff will provide you with a microphone.
Yep, feel free to, over here. Please state your name. Thank you.
Hi, I'm Xiao Mei from Schroders. Just a question, you talked a lot about hardware when building hospitals and clinics, but can you talk a bit more about soft skills and especially about labor, the availability of the pool of labor in the medical profession, whether there's a supply shortness, what needs to be done to train people if necessary? Thanks.
You talk about generically, overall, not what we're doing in BGS, right? Okay. I think all this, I see no problem with capitals, investments, and legal maybe, and whenever it will happen. I still feel the part that we have to concern the most is still coming down to healthcare, skilled healthcare personnel. In 3 prongs. First one is healthcare personnel in service, in clinical services, and how we prepare all those. And if you talk about Thailand, if I'm talking about Thailand right now, we want to prepare enough doctors and nurses and pharmacists, technicians, and other personnel. And we are doing fair. And there's lots of complaint about private side, still healthcare professional from public and fighting that, and this laws, rule, regulation coming up. But right now, the government start to look differently. The government start to look at, the government is taking care of Thai people, and they cannot use the public hospital to take care of all of them. Some parts still have to be, almost 1/3. Still under care of the private sector. So right now the government start to talk to private sector. The private sector now, I still feel in order to prepare personnel enough, just for Thailand situation, the public side, private side, and we have one strongest part of player here, professionals. Medical council, nursing council, dental council, very strong. They can tell the government, you go there, you don't mess with us, things like that, because they have to protect the safety of the Thai population also. So if public, private, professional can work together, they can prepare together. We have enough space in our or resources in teacher, in hospital, in training, in private side also. And if professionals allow us, we can increase the number of doctors. And even though right now our doctors are getting much, much more in Thailand, but before you can use them, it has to be 10 years after that, after they graduate. Training, the skill training is much more important. So if that happens, then I think we are well prepared for AEC. Now, second prong, research. All those PP will have to work together to do a serious, meaningful research in our country that really point to things that we have that the rest of the world does not have. And number three, training. All those people have to be together and help train, like I mentioned, nurses, doctors, when they graduate. They have to be fully trained, have fully skilled before they go out and affect life of so many people. So if PP can do those three clinical service, research, and training, I think we're going to be much stronger and we can take care of all those. We can go anywhere and we can take good care of our own people also.
Yeah, please.
Any other questions from the audience?
Okay, I think that's...
Okay, maybe I'll just ask one last question then, นะครับ อาจารย์ Chatree. If you have to rank the LVMC countries in terms of the level of attractiveness among themselves and versus Thailand, how would you rank them, in which order, and maybe your reasonings?
I'll go to Myanmar first because they're just opening, they're untouched. And they do have a lot of resources. They do have needs. Right now, Myanmar patients flying to our hospital is number one. They just beat people from the Middle East monthly. So they need help. So number one will be Myanmar because they're ready for everything. And they're willing. And they're on the private side, the doctors from Myanmar, they're very, the doctors from Myanmar, they want to learn. They have more doctors that have lots of knowledge. They just don't have opportunity to practice. If we happen to open a hospital there, I'm pretty sure there are lots of knowledgeable doctors who come and join us. Number two, people from Myanmar, they really listen to the doctors well. Maybe because influence of British influence long time ago. They don't complain. They don't bargain much. They will do whatever the doctor want them to do. But overall, I think invest in Myanmar would be number one, that would be the most fruitful. Rank number two, I would say, it would be Cambodia, because Cambodia have resources also, gas, oil, everything. And like Myanmar and Cambodia, Thai companies going out a lot too. We have chance of having Thai companies that's stationed over there to come to use our service also. Cambodia will be the reason close to Myanmar. However, they're smaller. Okay. Number three, I would say, would be Laos. Laos has a lot of resources. And last on the rank in India, and it's just personal, okay? I'm not saying anything negative, but Vietnam, we leave the last one, because Vietnam, they can do their own job. Like you see that over there, they do good job in taking care of their own people. So the only chance in Vietnam would be very, very super complicated patient will come to us. But the rest, it's not going to be an easy thing to go to Vietnam. It's going to be hardworking, and only for super sick patient, then you have a chance to take care of them because they can take care of their own people. Actually, Vietnam is our biggest competitor because lots of people from LVMC, they go to Vietnam also before they come to us, especially the patient with the middle class, on low middle class, they go. From Cambodia, they have almost half of the country.
Okay, well, if there's no more questions from the audience, I would like to end the session, and thank you very much to Ajahn Charti for being here with us today. Thank you, everyone, and I hope that you found the session informative and interesting. Now, I would like to invite everyone to lunch And thank you very much for being here. ขอบคุณครับ
Thank you very much for the informative session from Dr. Chatree and Kun Chatree, so that we could see the opportunity to invest in healthcare sector, particularly in CLMV countries, right?